There are people all over the internet who claim that a whole food plant-based diet can reverse heart disease. Not just improve how you feel or maybe help you lose a little weight, but actually reverse heart disease. Like when you look inside a blood vessel and see plaque in there, they're saying that a diet can literally reverse that process. That's a really big claim. But is it actually true? Well, that's what we're going to talk about today, so let's get going. Atherosclerosis is the buildup of plaque inside of our arteries. It's a pretty complicated process that involves inflammation and cholesterol and a bunch of other things, but in general, it's a narrowing of your arteries. So, what would you need to definitively prove that a diet can reverse atherosclerosis? Well, we need at least two big things. First, we need a randomized trial so we know that the two groups aren't different in some way that can skew the results. Second, we would need an intervention where the only thing we adjust is diet and change absolutely nothing else in the study. If we change anything else besides the diet, then we're not sure if it was the diet that made the changes or something else altogether. We should also have a third component, which includes a gold standard way of visualizing inside the artery, but we'll ignore that for right now because the first 2 points are all we need to make my point. So now let's dive into a few of the articles I've seen cited as evidence to prove a reversal of heart disease from diet alone. I've predominantly seen this claim coming from the whole food plant-based community and specifically stating that a vegan diet can reverse heart disease. I've seen this first study mentioned a bunch of times, so let's take a closer look. The first study we're going to look at is the Ornish Heart Trial, which was a randomized prospective trial that looked at to see if lifestyle changes could help reverse heart disease. Let me reiterate that. They looked at lifestyle changes in the study and not specifically just the diet. The experimental group ate a vegetarian diet with no animal products other than egg whites and 1 cup of no-fat dairy per day, but they also included exercise, stress management, smoking cessation, and group support into the experimental group. So the diet in the study actually included some dairy and eggs, which means this is not even a traditional whole food plant-based diet, but we'll ignore that and continue to move on. They used angiography to measure the level of atherosclerosis before and after the intervention, and that was their main outcome in the study. An angiogram is a type of study where they inject some dye into the arteries of the heart. Then they use x-rays to see how open they are. Just like any imaging modality, there is some margin of error, but this is what they used for this study. And what did they find? Well, they found that at 1 year, the experimental group had a bunch of improved markers like cholesterol, ApoB. They lost about 20 pounds on average, actually, and they had improvement in the lesions they saw on the angiograms. So does this prove that the diet caused these outcomes? Not in the slightest. As I mentioned before, the experimental group had so many things that were changed in them that we don't actually know what made the difference. Was it the diet? Or maybe it was the exercise or stress management? Or maybe just the fact that it lost 20 pounds made the difference? Who knows? The point is, we can't speak with any certainty based on this study. This isn't meant to rip on the study. In fact, I think this is a great study and shows that an intensive lifestyle intervention can not only be feasible, but can be really helpful with symptoms and lab values, but it doesn't show what some people claim it shows. Next, let's look at another study that is used to say that a whole food plant-based diet can reverse heart disease. And this is the study done by Dr. Esselstyn in 2014. This was a case series that followed patients who undertook an intensive lifestyle intervention involving a diet full of whole grains, legumes, lentils, vegetables, fruit, and no fish, meat, oils, dairy, avocados, nuts, or processed foods. So this is a super restrictive diet. They used a bunch of different outcomes, including looking at some tests that look for coronary artery disease, like different forms of stress tests, and looked at things like heart attacks and strokes, and found that those who follow the diet closely seem to have the best outcomes. So does this prove the reversal because of the diet? You might be saying, Jordan, the only thing they really changed was diet. Well, no, this does not. Yes, they did change the diet predominantly, but there's a few big reasons why we can't prove anything with this study. First, this was just a case study. So this was not truly an experimental study, so we automatically can't determine a causation from that. Second, they did change diet predominantly, but we don't know what else they changed during the study. Did the experimental group exercise more? Did they do other health promoting things? Possibly. Also, once again, the intervention group lost almost 20 pounds, so that could also be playing a role in this. The participants of the study were super motivated and might have just been a highly motivated group of patients who may also adopt other healthy habits, which may lead to these improvements. So, like our previous study, this was a great study that showed that this dietary approach may have some benefits to offer, but in no way, shape, or form can we claim that you can reverse heart disease from this study. Finally, I just wanted to play devil's advocate for a second and talk about one additional study. This study was based off of the Cardioprev study out of Spain. The study looked at a Mediterranean diet group versus a low-fat diet group, and they looked at thickness of the carotid artery, which is a proxy for atherosclerotic disease. This was part of a bigger study that looked at cardiovascular outcomes, but in this study, they looked at secondary outcomes of atherosclerotic disease. This study did try to adjust for things like BMI, weight, cholesterol levels, and smoking, but once again, even with that, we can't say this diet caused anything. What they found was that the Mediterranean diet appeared to decrease the thickness of the plaques, and the low-fat diet did not. So, if we treated this study like others have treated previously mentioned studies, then we could say and make headlines that the Mediterranean diet can reverse heart disease. However, we can never do that with any academic integrity, so I won't be going around saying that at all. With that being said, it's entirely possible that these dietary changes could reverse heart disease. Listen, in all these studies, we seem to have some improvement in visualization of atherosclerosis in patients, so it may be possible to partially reverse heart disease. However, it's just so much more complex than that, and none of these studies can be used to definitively say that one specific thing reverses heart disease. I'm encouraged that all these studies showed great improvement in other patient outcomes as well. So I think the big takeaway is that making lifestyle changes and diet changes can have a really big impact on your health. So we should always take that seriously. Remember what a difference these things can make in our lives. As always, one study is just that, one study. We can't extrapolate these findings without thinking about them in the broader context of the overall literature. If you want to see me talk about these studies in more detail, you may enjoy the video podcast where I talk about some additional studies and how all these things fit together.